सकारात्मक सोच को आओ सारे भारत में फैलाए, सकारात्मक ऊर्जा का आओ सब में संचार कराए। ऐसा ना हो कि हम अपनी जिम्मेदारी भूल न जाए, क्यों इंतजार करें हम किसी का, आओ एक मशाल जलाए।
आज एक दिल्ली मेडिकल एसोसिएशन ने एक वर्कशॉप का आयोजन करा जिसमें कि साल्ट फाइट का मतलब है कि जो साल्ट में हम कितना इसको रेस्ट्रिक्ट करें। ये पूरे दिन की एक कार्यशाला है जिसमें कि एक सेपियंस इंडिया है, रिजोल्व टू क्राइसिस है, इस तरह की 3 संस्थाएं हैं जो कि दिल्ली मेडिकल एसोसिएशन का मिले, जिसमें डॉक्टर विजय खेर इसमें प्रमुख हैं। आज के मुख्य अतिथि डॉक्टर विनोद पॉल थे तथा गेस्ट ऑफ ऑनर डॉक्टर राजीव सूद और डॉक्टर अतुल गोयल थे। इन सब का निचोड़ यही था कि हम उसको कैसे इसको साल्ट को रेस्ट्रिक्ट करें और जनरल डॉक्टर्स को, जनरल पब्लिक को अवेयर करें साल्ट रेस्ट्रिक्शन के बारे में। और ये ताकि साल्ट जो है डायबिटीज़ और हाइपरटेंशन को तो डायरेक्टली इन्वॉल्व करता है, इसमें बिहेवियर चेंजेस भी इसमें इन्वॉल्व हैं पब्लिक के, और इसी चीज़ पे आज एक दिन की चर्चा होने जा रही है।
जी, तो डीएमए आगे लेकर इसको अभियान को कैसे करेगा?
डीएमए ने आज जो हमारे डॉक्टर्स को एजुकेट कर रहे हैं, एक दिन का जो हमारा कार्यशाला है, जो फिजिशियन जो इसमें आज इन्वॉल्व हैं, इसके बाद इसको हम ग्राउंड लेवल पे जाके जब ये जो हमारे जो डॉक्टर्स आज इसमें अवेयरनेस में पार्टिसिपेट करेंगे, आगे जाके पब्लिक को बताएंगे कि कैसे कैसे इसका जो साल्ट का नुकसान है, कितने मिलीग्राम साल्ट लेना चाहिए, एक सारे दिन की कार्यशाला के बाद निकल के आएगा।
इनॉग्रेशन में क्या कहा गया कि लोगों को कितने साल्ट की जरूरत है, और गर्मियाँ आ रही हैं, गर्मी है तो क्या ज़्यादा?
इनॉग्रेशन पे यही था कि दो मिलीग्राम लेना है, पर उसमें 2 मिलीग्राम कैसे किसी को पता पड़ेगा 2 मिलीग्राम लेना है, या खाने के ऊपर लेना है, नीचे लेना है, या पिकल्स जो हमारे जो हट डाइनिंग टेबल पे रखे होते हैं उनका क्या महसूस रहेगा, प्लस गर्मियाँ आ जाएंगी जब में पसीना निकलेगा उसमें क्या रहेगा, या हाइपरटेंशन की दवाई ले रहा है तो उसके साथ साल्ट को कैसे रेस्ट्रिक्ट करेगा। ये सारी चीज़ें जो अब पूरे दिन की कार्यशाला में निकल के आएंगी समाधान इनका।
दिल्ली मेडिकल एसोसिएशन द्वारा सॉल्ट फाइट के मुद्दे को फिजिशियंस के साथ सॉल्ट रिडक्शन एंड लो सोडियम सॉल्ट सब्सटीट्यूट्स पर कार्यशाला आयोजित करके, जिसका कि उद्घाटन डॉक्टर वी.के. पॉल, नीति आयोग, गवर्नमेंट ऑफ इंडिया, और डॉक्टर अतुल गोयल जो महानिदेशक स्वास्थ्य सेवाएं भारत सरकार, और डॉक्टर राजीव सूद, वाइस चांसलर BFUHS, सबने मिलकर, और दिल्ली मेडिकल एसोसिएशन के सभी अधिकारी, डॉक्टर गिरीश त्यागी प्रेसिडेंट, डॉक्टर सतीश लांबा स्टेट सेक्रेटरी, डॉक्टर नीलम लेखी प्रेसिडेंट इलेक्ट, और डॉक्टर AS पोपली फाइनेंस सेक्रेटरी, डॉक्टर विजय खेर किडनी सपोर्ट नेटवर्क, और प्रोग्राम कोऑर्डिनेटर थे डॉक्टर अनिल शर्मा। पहलगाम के शहीदों को मौन रहकर श्रद्धांजलि दी गई। तो किस तरह से ये कार्यशाला आगे बढ़ी, आइए जानते हैं।
Welcome sir, good morning on behalf of Team DMA. We welcome Dr. V.K. Paul. So it's the time for presidential address. I request Dr. Girish Tyagi sir, President Delhi Medical Association, to please come on the dais for presidential address. Dr. Girish sir.
Chief guest for today's program, Dr. Vinod Paul, guest of honor Dr. Atul Goyal, Dr. Rajiv Sood, Dr. Neelam Lekhi, President-elect, Dr. Vijay Kher, who is the man, Ravichandran, Dr. Satish Lamba, and dear friends. This program was fixed around 1.5 months back when Dr. Vijay Kher called me then that he wanted to do a program with Delhi Medical Association and with Dr. Tyagi in particular, because he said कि program आपके साथ ही करना, आपके year में करना. Then of course the date was fixed for 27th April, around 1.5 months back. Then this program लो सोडियम का हमारे जैसे कुछ पता भी नहीं था कि लो सोडियम का क्या इम्पैक्ट होगा क्या नहीं होगा, बट ऑफ कोर्स he told that it has a, and now we have come to know that low sodium is a very beneficial and critical part for the health of the, whether it is kidney or whether it is hypertension. So I welcome all the delegates who have come on the Sunday morning, and our guest Dr. V.K. Paul, Dr. Atul Goel, Dr. Rajesh Sood, who has come on the way all the way from Sunday, and Dr. Atul Goel in particular. Today is the last day as DGHS. He will be remitting the office of DGHS today only. Then at least he has agreed to come to this program. Of course, he is a good friend of mine. We are both from UCMS, and we have in the Delhi Medical Council also. He was coming as a expert member in the medicine cases, and I've seen the methodical and the clear working of Dr. Atul Goel. And we all know Dr. V.K. Paul, who is the man behind the health policy which the government of India is implementing, and of course then it will be states to implement the health policies which are sent by the central government also. So once again, thank you very much for your appearance.
Thank you, Dr. Girish sir. Now you request the dignitaries on the dais for lamp lighting. So we should inaugurate the program. All the dignitaries on the dais should join for lamp lighting. Our coordinator of the program today, Dr. Neil Sharma, should also join for lamp lighting. Now I request Mr. Sundar from Sapiens to please start the program.
Good morning, Namaste and Swagatam. We will commence the proceedings with a silent prayer for a couple of minutes for those brave hearts who died in the dastardly terrorist attack at Pahalgam. Please raise in your seats for the silent prayer for those innocent victims. Thank you. Be seated. It gives me, R. Sundar, trustee of the Sapiens Health Foundation, immense pleasure on behalf of Sapiens Health Foundation to greet all of you, the eminent doctors fraternity and invitees for a very educative, enlightening workshop on capacity building of physicians on salt reduction and low salt substitutes in the vibrant national capital of India by a team of eminent medical professionals and illustrious achievers. A disclaimer from me, I am a compeer for this 3-hour insightful sessions without being a medical professional, and any comments, remarks that I would be sharing is from a common man's perspective on common salt. Dr. Rajan Ravichandran, the chairman of Sapiens Health Foundation and the world-renowned nephrologist, has piloted this major initiative in collaboration with Resolve to Save Lives, with the distinguished Dr. Vijay Kerr in command for this third concluding workshop, as Sapiens and RTSL completes a hat-trick of workshops to draw the attention of the entire nation from the corridors of power. The first was held in the cultural capital Chennai, followed by the business capital Mumbai, with Dr. Umesh Khanna leading and making it count, and the concluding one here as we cheer, it's your turn, Delhi Capitals, to roar and be triumphant this season. And the name says it all, Vijay, says Dr. Kerr. It is heartening to see the physicians' army, the salt fight warriors, who will be in the forefront for this cause and make the citizens of our nation healthy and strong with reduced salt intake. We are indeed very happy to welcome the several eminent guests on stage, distinguished Dr. Girish Tyagi, Dr. Vinod Kumar Paul, eminent Dr. Atul Goyal, Dr. Rajiv Sood, and all the professionals who are keen to pick up new learnings, and of course, the ever-supporting friends from the media, the faculty members from DMA, Dr. Manika Sharma, and the active team from RTSL. May I say to all of you, Swagatam. A few announcements as we commence the program. Request all those seated inside this auditorium to keep your mobile phones on silent mode. We have limited time to cover a number of topics, and should you have any questions to any speaker, please raise them during the session which we have scheduled for a question and answer session with the experts. A special request, of course, goes to all the speakers to adhere to the time allotted to them so that we manage the resources effectively for the day, so that you have an enjoyable Sunday afternoon. Kindly cooperate. Now I invite Dr. Girish Tyagi to say a few words. He is one of the most professional and... Okay. A word of introduction about him. He is one of the most respected professional and able administrator, president of DMA, and is here to pitch for a cause. And I'm sure he will, along with the rest of his colleagues, take this movement forward through the DMA. And of course, with all his resources and rapport with the doctors fraternity, I'm sure his contribution in leadership through education, administration areas will improve not only for this cause, but of course the medico-social causes which he engages and cheerfully supports. Thank you, Dr. Tyagi, for your presence. I now request Dr. Rajan Ravichandran, Chairman, Sapiens Health Foundation, and the visionary who embarked upon the SALT program in 2010 ahead of time and successfully leading the march to achieve reduced salt take in India. He has, amidst his busy and punishing work ethic, treating thousands of patients from all over India and Chennai, passionately pursuing this major initiative. A celebrity doctor, treating several celebrities, he is one of those rare, passionate, and very, very committed doctor professional who wants to improve the health of the nation. He has covered with more than 100 lectures and in several articles and interviews in print and visual media the importance of what I would describe as Pancha Mantra, that is 5 grams of salt only for your diet. He has launched several awareness campaigns and held 2 seminars in IIT Madras and IIT Mumbai, and the first workshop on capacity building of physicians on salt reduction was held in Chennai IIT in June 2024, followed by the Mumbai one with the Indian Medical Association and Dr. Umesh Khanna leading the show in December 2024. His impactful contributions have been hailed by the entire media, the print and the visual media, and for the last 27 years, the Sapiens Foundation has been in the forefront of committed service to society. His impactful communication on this subject last 1 year has covered more than 3,000 plus doctors in Tamil Nadu, including the doctors from primary health centers and government hospitals. I think that requires a bit of a cheer from this audience, because one single mission of a doctor to reach out to more than 3,000 plus doctors has been hailed by the government of Tamil Nadu as well. Put your hands together to greet the champion and architect of this campaign, Dr. Rajan Ravichandran, for his presentation.
Dr. V.K. Paul, Dr. Atul Goyal. Is it on? Where is the percentage? Yeah. Dr. Atul Goyal, Dr. Rajiv Sood, Dr. Girish Tyagi, and my dear friend Dr. Vijay Kher, other dignitaries, colleagues, and friends. Sapiens Health Foundation was started in the year 1997 with the view of helping patients with kidney disease. We took up preventive programs after that, and from 2010, we have been campaigning for low salt intake in this country. So we organized the walkathons in major cities in Tamil Nadu, and with celebrities walking on the beach on a Sunday to create an awareness. So first we started with creating an awareness for the need for reducing salt in the population. As you are aware, the number one killer according to WHO is hypertension and its complications, strokes, heart attacks, and kidney disease. And the single most important factor for hypertension and its complication is the salt intake. So it's a very simple, effective method where you can reduce strokes, heart attacks, and kidney failure by reducing salt. These walkathons were conducted in other cities. This is in Pondicherry. The effect is still there. In Pondicherry is the only state in the country where there is enormous campaign still going on for low salt, and low sodium salt substitutes are freely available there. This is in Trichinappalli again. And of course, we released a number of posters with celebrities showing that they send a message for reducing salt intake. And the WHO's recommendation is 5 grams of salt per day and 5 ways to reduce your salt intake to 5 grams. This is a very popular poster where we suggest how you can reduce your salt intake. Again, very important mythbusters we have used, where people feel that in summer months you should take more salt because you are sweating more. So if the sweat glands get acclimatized, and you will find that what is lost in sweat is water and not necessarily salt. The sodium content of sweat is very low, only 5 milliequivalents per liter. So what you require is water replacement rather than salt replacement. Another important myth is the salt intake for children. Children require actually less salt. In the first year of salt, you do not require any salt at all. And by the age of 12, gradually you should reach the adult requirement of 5 grams per day. In the UK, school children are served without salt. It's a very important program. Of course, the other complications of salt other than hypertension and endothelial dysfunction. That's why you can get strokes, heart attacks, and kidney failure even in the absence of hypertension because of salt, since the endothelium gets damaged. The other important complications including cancer stomach, kidney stones, osteoporosis, and bronchial asthma. Of course, this is a very interesting poster we have where the chimpanzees in the wild have a blood pressure of 90/60. The same chimpanzee you put in the zoo and feed the human food, by end of 6 months, the blood pressure comes to 130/90. Of course, we have been writing to 300 food manufacturers asking them, salt is a very important preservative. So food manufacturers use salt to preserve food for a longer shelf life. We have written to several 300 food manufacturers and we are happy. Some of them have responded. In India, Nestle has reduced the salt content of instant noodles. The highest salt content was in the instant noodles. Many people are not aware that bread is a very important source. This is very important in the UK, that in the last 10 years, they have progressively reduced the salt by 33%, and there is a drop in strokes by 25%. A very important achievement in the UK. If you go to UK now, you will find that salt reduction is very evident. You go to restaurants where the salt is less in food, and in the bread, the salt has been brought down by 33%. As I said, many people are not aware that sweetened drinks like the Coke and cakes also contain salt as a preservative. So as I said, we have been releasing posters for various salt campaign, and in 2014 we got the Notable Achievement Award by the World Hypertension League for reducing salt in Indian population, and this has been published in the Journal of Circulation. Of course, we have used celebrities. Venkaiah Naidu, Sri Venkaiah Naidu, when he was the Vice President, he spoke on the importance of salt in the medical conference. He helped us. Of course, we have street plays in the slums. A lot of people think, the poor people think that they don't get hypertension. So we conduct street plays in slums where we go and call them and have a humorous play for about an hour and talk about the importance of reducing salt intake. Very popular these plays are. They are humorous, but of course they are in local language. The first international conference we held in 2017. You could see next to me is Professor McGregor from the UK. He is the pioneer in the world, I should say. He started the WASH, World Action on Salt and Health, in 2005. And he has been a single man who has been responsible for reducing the salt consumption in the UK. He was the chief guest for the conference. Soumya Swaminathan, who was at that time in the WHO, and of course the Directorate of Public Health, and from the Food Safety Standards of India, was present attending. This conference was held in IIT Chennai, well attended by people. We also had the same conference in IIT Mumbai also. The New Year resolution we passed in 2019 that the salt shaker should not be kept. What we found is if salt shaker is kept in the restaurants, people even without tasting add salt in the soup, and they talk to each other and they go on adding salt and increase their salt consumption. So we approached the restaurants and requested them not to keep salt shakers, and 60 restaurants obliged us, and they don't have salt shaker on their table. We have to ask for it. Again, we had an essay competition. Most important are children and schools. If they know that the salt has to be reduced, they can use it better. They can point out to their parents. So we had an essay competition in school children and on salt, and this we regularly conduct in several schools. In the World Kidney Day, we released salt substitutes. You would have realized that in India, salt substitutes are not available. For example, you want to buy a Lay chips. There is no salt, raw salt as alternative that is available. Whereas you go elsewhere, even in Sri Lanka or Singapore, you will find that the Lay gives you normal salt and low salt alternatives available. So we have been demanding that India should also have it, and we release these snacks in Chennai. Of course, the 2023 we had the 25th anniversary function where we had superstar Rajinikanth and Venkaiah Naidu participating in the conference. Our popular video is on the net for 2 minutes by Rajinikanth, which is very popular, where he talks on the importance of reducing salt in his own household, his own experience in hypertension. Of course, we formed the Low Salter group, which you could become a member. You just simply type lowsalter.org and you'll find articles on the relationship of salt and health. Both medical and non-medical people, we enroll them as members. With the Directorate Health of Public Health in Chennai, in Tamil Nadu, have been very cooperative, and we have had programs. We have several lectures, and about 2,000 primary healthcare physicians attended it. And recently they have sent a letter to all the primary health physicians to create an awareness of reducing salt intake in these people, and not to use alternate salts that are available in the country, like the Himalayan pink salt or the rock salt or Senda namak, because you can get an iodine deficiency if you try to use them, and they don't have less sodium in them. Of course, the last collaboration we have been having with the Resolve to Save Lives, Dr. Manika is present and others are present from there, and we have had workshops. So this is the first workshop we held in June in Chennai. Then subsequently we held the workshop in Mumbai in December. This is to empower, make the physicians aware. What we found that physicians are first not aware what should be the salt consumption that is recommended, what are the ill effects of salt, and how to implement it. So this is the third workshop today we are having in Delhi, and I am sure with all of your support it will be a grand success. Thank you.
We will now have Dr. Vijay Kaur, who is a very resourceful leader in Delhi and who has taken this initiative to conduct this program exclusively for the physicians in Delhi. He is a renowned nephrologist, chairman, Division of Nephrology and Transplant Medicine, New Delhi. He brings with him a wealth of experience and expertise, having worked with dedication in the field for over 4 decades. Decorated with several awards and honors, his contribution through articles and research papers, over 250 as on date, deserves a special mention and acknowledgement from this audience. All enthusiasm, commitment, his support to make this event possible in Delhi deserves another round of cheer to the captain of this show. And now his welcome address.
Thank you, Sundar. Good morning, ladies and gentlemen. I must at the outset welcome all of you to this and must thank you for sparing time on a Sunday morning to be getting aware of the SALT Fight program and the physician. This workshop is very, very important for making you understand as to how and why we should reduce salt in the diets in this concern. I must at the outset welcome Dr. Vinod Paul and thank him for accepting our invitation to come and bless us here on this occasion. And I must also thank Dr. Atul Goyal and Dr. Rajiv Sood for having accepted to come and bless us on this day. I will again like to thank Rajan and other members of the low salt group to have given us this opportunity to have this awareness program, this workshop for the physicians here so that we can carry out this campaign. And I'm sure with Dr. Vinod Paul here in the audience, I think this could be a sort of a request for putting this on a national health policy as well, because with his presence, he is obviously championing the health policy of the country. And I'm sure as a preventive program, this can be extremely useful, cost effective, and even the return of investment that one looks at these days. I think the return of investment by cutting down the salt in the diet would produce an increase in the lifespan of people because it decreases the incidence of hypertension and therefore would reduce the most important risk factor for cardiovascular mortality. And I think that's extremely important. And I'm sure that Dr. Paul is going to touch on this. With this, I would again like to thank him as well as Dr. Goyal and Dr. Sood to have accepted our invitation and come and do this and bless us here today morning. Thank you very much.
Thank you, Dr. Kaur. We take immense pleasure in welcoming the distinguished Dr. Rajiv Sood, Vice Chancellor, Baba Farid University of Health Sciences, a very resourceful person and a well-known medical professional. His penchant for contributing through the medium of medical education is noteworthy. He was Dean and Professor of Urology at Dr. RML Hospital, New Delhi, prior to taking up this prestigious chancellorship. We look forward to his ideas and plans to strengthen this movement, and of course, also his inputs to make the strategies vibrant to support the low salt initiative. I welcome Dr. Rajiv Sood to share his thoughts.
Thank you, sir. Respected Professor V.K. Paul, Dr. Atul, Dr. Ravi Chandran, Dr. Vijay Kher, our DMA President, Dr. Girish, President-elect Dr. Lekhi, immediately past President Alok Bhandari, Dr. Satish Lamba, and all the dignitaries of the dais. It is a great initiative by Sapiens Health Foundation and the SALT, being the urologist and dealing with all the kidney diseases or related problems. I present before you to listen and learn much more things which I know as this professional. But one thing is sure, that right from the beginning we know that salt is to be taken carefully, extra salt. As has already been mentioned, that infants, they don't need added salt. And when we are talking about the salt, we are talking about the sodium containing salt. Because I know as a urologist, salt is not only pro-inflammatory, it is bad for immunological diseases. It is also, we are living in stone belt. And the stone belt, Delhi is also in stone belt, and sodium chloride, which is the salt, that increase the recurrences of the problem, obstructive symptoms, because of anything, including urinary obstructive symptoms, including UTIs. UTIs are not cured by reducing the salt, but the symptoms definitely come down. So in addition to heart, in addition to the stroke incidences, it is recommended that when the chronic problems are there, renal problems, we say that restrict the salt. And restrict the salt, as it was told, that 5 grams of salt is there, that we don't recommend more than, in such patient, more than 2000 milligrams of salt in all forms in the daily diet. So education on salt, some very prestigious on iodine and all, even awards like Padam Shri and all have been conferred upon. But the knowledge and spreading this knowledge amongst the physicians very carefully, which is done systematically by the series of meetings and such awareness campaigns, is essential, not only essential, very that is yielding the great results in the health of the sapiens, Homo sapiens, because salt, which we are discussing today, the quantity, the quality, we change even in the alkalizers from sodium to potassium, and the load on kidney, the proteinuria comes with excessive salts. So many things are there. And again, hypertension is increased. Again, the heart risk, the stroke risk increase. This all has been said, and everybody is telling this. Only the thing is that we have to imbibe it in our daily practice, in our prescribing capacity, in our awareness programs, and also in our curriculum also. It has to be stressed upon when we are teaching our undergraduate, postgraduate, super specialists, because this is one ingredient of the food which is affecting each and every discipline. And with this, I thank the organizers for touching upon this important issue and making us more aware than before. Thank you very much.
Thank you, Doctor, for sharing your perspective. And I'm sure everyone would have got the message how to imbibe these learnings in our daily lives. Professor Dr. Atul Goyal, who is here with us, is a highly acclaimed and active medical professional currently serving as the Director General of Health Services and Director National Center for Disease Control under the Ministry of Health and Family Welfare. His academic and clinical expertise...
I would introduce myself.
Oh, okay. But just a word that he's really a multifaceted person who deserves our grateful acknowledgement for being present with us. And one rare point which I was taken on was that he strikes a different approach, emphasizing the integration of physical, mental, social, and spiritual well-being. And that says it all about the personality. As they say, exercise is king, nutrition is queen. Put them together and you have got a kingdom. Over to Dr. Goyal for his thoughts.
Thank you so much. A very good morning to all of you. Respected member Neeti, Dr. Vinod Paul, my colleagues on the dais and my colleagues in the audience. Actually, Dr. Kher messaged me about 10 days back about this program. And I was in two minds. As it was my last day in office, I wanted to skip it. But then I thought that with Dr. Girish Tyagi there, who's been a very close friend right from 1980, when I joined UCMS, he was 1 year senior to me. I said the best way to part would be to be part of DMA function before I come back. Pardon me if I actually have some thoughts which may be different from what is being said. But I would say my thoughts come from my being a physician. I am not a one-sided person, like I'm not a urologist, I'm not a nephrologist. I think of the body as a whole, so my thoughts may be slightly different. Whenever we talk of reducing one single element in diet, it perplexes me. Because personally, I believe in the age-old saying that has always been said by our ancestors as well. Everything in moderation is good for human bodies. Would say that we have moved away from nature in every sphere of life. If you imagine the life today, we have actually moved far away from nature in every sphere of life. The way we think, the way we live, and the way we eat. Nature has provided the right amount of everything that is present in naturally produced food. Whatever has been artificially produced by human beings is generally harmful to health. And when I say that, I talk of salt. Salt is an artificially produced product when we use it as a separate salt. Then sugar, then refined oils and fats, genetically modified crops, processed and ultra-processed food, even modified water. For example, today we are taking mineral water and then, packing these minerals in small capsules and taking them as micronutrients, which actually doesn't make any sense to me. So I have a few worries when I say of restricting salt alone. My first worry is that how does the common man measure his salt intake and limit it to 2 milligram, 5 milligram or 10 milligram? It's very easy for us to say in research papers or as physicians, if I tell my patient, reduce your salt to 2 milligram, what does he do? Does he measure? Does he weigh his salt on an everyday basis? So the message has to be somewhat different. My second worry is impact of modern medicine on salt. A lot of injectables that are being used actually have sodium, have potassium in high quantities. A lot of the medicines that are used have an impact on sodium. For example, diuretics used as hypertensives, as antihypertensives, they reduce the sodium. And why I mentioned about that is the third worry. About restricting salt in a tropical country like India, where temperatures soar to 48, 49 in certain parts of the country and people sweat like anything. Have we ever thought of people on antihypertensive drugs, including diuretics? And why I say that, I see many patients actually dying of hyponatremia in the emergencies of government hospitals without even being diagnosed. Because without any supervision, they have been taking their antihypertensive drugs. And since there would be many practicing physicians here, I'm sure you should be aware that in a country like India, the requirement of antihypertensive drugs goes down in summers and it increases in winters. So you should be aware of that. And this may be actually restricted to sodium loss during summers that occurs because of the weather itself. You see, how many of us can actually afford even coolers and air conditioners? The people who are on the roads, who are actually working hard, and taking antihypertensive drugs, we have to think very differently. To conclude, I agree that salt intake needs to be decreased to as low as one can, while not being I will also say don't opt for any substitutes. I have always treated my diabetics in the similar way. I have asked them not to take sugar substitutes. Similarly, I would say don't actually take any salt substitutes, for the simple reason that your body adapts to the taste over a period of time. You stop taking salt for a certain amount of time or reduce it to very minimal. After a certain period of time, you will realize that you don't actually need that much of salt. This period of adjustment takes about 2 to 3 weeks, but if you do that, it's remarkable. So with that message, I think I will end my talk and hand over the stage to Dr. Vinod Paul, who would be educating us more on the fact.
Thank you, Doctor. We now have the pleasure of greeting our chief guest for this morning, Dr. Vinod Kumar Paul, currently serving as member Niti Aayog and a man of multiple achievements. A policy maker, he is associated with India's health policy as well as child and many programs promoting good health. We must appreciate and applaud him for conceptualizing the Ayushman Bharat program, the largest health insurance program of the government of India. The program aims at universal health coverage by providing free hospitalization to 500 million people. Dr. Paul has also contributed towards formulating the Poshan Abhiyan, the Government of India overarching scheme to improve the nutritional outcomes of children. He is in several boards and guides several institutions, heading them, supporting them, and participating in those institutions. And we can all be proud of his contribution during the pandemic. And it was because of him that the whole movement to give vaccine, and he was one of the person who chaired the Empowered Group on Medical Emergency Management Plan also. His vast experience in handling responsibilities with focus on deliverables has earned him a lot of appreciation. We welcome him and request him to give his presidential address.
Before Dr. Paul starts his speech, and as Atul Goyal sir has to leave for prior commitments, I request Dr. Girish Tyagi sir, President Delhi Medical Association, to felicitate Dr. Atul Goyal. I request Vice President Dr. Prashant Seth to join for felicitation of Dr. Atul Goyal.
I'm sorry for leaving in between, especially apologize to Paul sir. All the best. Thank you.
Namaskar, good morning. Dignitaries on the dais, my very distinguished colleagues, friends, fellow doctors. I am truly honored and happy and delighted to be here amongst my fraternity. You are the leadership of Delhi, but more importantly, you represent profession's leadership in the country and beyond. I've had the privilege of coming to this hall several times in the past in my previous avatar of a pediatrician and academic at AIIMS. It's very, very happy to be here. The importance of addressing one major risk factor of perhaps a top non-communicable disease is truly timely, if not a bit late, urgent, and an area which calls for deep thinking and vast effort. In the space of non-communicable disease, you would appreciate that at population level, we do not find major effort, but even more specifically, major successes in primary prevention. I want you to think about it. In this fraternity, there are academics, there are doctors, there are others. We are looking at how we can avert the consequences of non-communicable diseases on organ systems, on severer forms of morbidity, and of course mortality. Let me elaborate on this. I like to know at population level, not one-to-one. I'll come, as doctors we deal one patient at a time. I'll come to that part. I like to understand in which population of 1,000 or 100 or 500,000 or a district have we seen prevalence of diabetes coming down, prevalence of obesity coming down, chronic kidney disease coming down, and so on. तो मैं सबसे पहले ये रेज करना चाह रहा हूँ, हम इसके लिए माइंडफुल नहीं, हमारे पास क्या वो स्ट्रैटेजी होगी. This probably is the last message because there are more important messages for the discussion that we have. But I want to raise this fundamental issue. The Honorable Prime Minister very recently has given us a direction and B, a hint for us to think like that. When he said that he's concerned about the huge rising incidence, incessant increase in obesity and whatever else it brings. And I suggested one pathway कि ऐसा करके आप 10% आप ऑयल कम करो. एक शुरुआत हुई है. लेकिन मैं अपने आप से हम सबसे पूछता हूँ कि क्या हमने नॉन कम्युनिकेबल डिजीज में कौन सी चीज़ को बड़े तरीके से प्रिवेंट करने की कोशिश करें. I would agree here to put postscript and disclaimer. Yes, hepatitis B vaccine would help. Yes, HPV vaccine, when it goes to scale, would help. Yes, decrease in tobacco consumption over a period of time has helped in that particular form. Perhaps it has helped. And we have a program. But in the cardiovascular disease, in stroke, in kidney disease, that's fatty liver. हम लोगों ने प्रिवेंटिव स्ट्रैटेजी को बहुत ऊपर तक लेके नहीं गए हैं. हम इकट्ठे हो गए, डॉक्टर्स इंक्लूडेड, और हमने डेमोन्स्ट्रेट भी नहीं किया इंडिया स्पेसिफिक मॉडल दैट कैन चेंज द कोर्स. सो आई वांट दिस थॉट, ओवरआर्चिंग थॉट, टू बी टॉक्ड अबाउट, टू बी डिस्कस्ड, एंड इट इज फॉर academics like myself and others to demonstrate that in a village I can reduce, let's say, salt intake. I can improve, I can reduce use of tobacco. Okay, or we reduce कर सकते हैं, because in the recent expenditure survey, by the way, we all as Indians are spending more on tobacco, continuing to spend on that. It's now changed from one form to the other. So the first short point I want to make is that our efforts on primary prevention, and please do think about it, primary prevention of road traffic accidents beyond helmets, alcohol, जो सब कुछ cause करता है. Because as a society, if we don't do primary prevention, then A, we have lost the game partly, and B, there will be efforts as secondary prevention, and of course effort and spending and the misery and the damage and I would say large-scale mental stress when we are dealing with complicated cases. And I don't have to tell this here what it means to have somebody whose hypertension could have been controlled or diabetes could have been controlled, but at the age of 49 needs a kidney transplant. So सबसे पहले ये है कि प्राइमरी के स्पेस की बात हम नहीं है हमारे पास. मेजर डिसऑर्डर्स को, स्ट्रोक के बारे में हम सुनते हैं कि स्ट्रोक जल्दी लेके जाओ, आधे घंटे में, 2 घंटे में, वो हम ज़्यादा सुनते हैं, लेकिन जो उसके डिटर्मिनेंट्स हैं उसकी आवाज़ कम हो रही है. I like to therefore emphasize the fact that any effort that can lead to primary prevention of non-communicable diseases is absolutely laudable, and it is our duty as a profession to join, and it is even more of our effort that we systematically provide public health answers to this, because ultimately that's what it means. Just last bit on this before I move. Through the network of health and wellness centers, the Ayushman Arogya Mandirs, under the Ayushman Bharat कार्यक्रम, the second pillar of Ayushman Bharat, 1,74,000 health and wellness centers have been made functional from their previous level of serving as sub-centers with more rigor, more medicines, more than 100 drugs. A new health worker, professional, not worker, health professional, a graduate nurse with special training, 120,000 of them have been put in place recently and quietly. I'd like you to visit some of these and see that there is a new worker that has been put in place for India's people. Through that, what we are trying to do is, yes, we do talk about primary prevention as a limb, and we are making some efforts in that regard, but our key strategy has been checking blood pressure, checking diabetes, and early cancer, detection of cancer, and then start putting them on the pathway for treatment. That's secondary prevention. तो प्राइमरी प्रिवेंशन की बात जो है वो होनी चाहिए, आज हो रही है. That is there for a very special day. I want to start with that. And here again, what are the models? What changes an element, a risk factor on scale through preventive approach? How do I change the habit of 1,000 people in a village or 1 lakh people in a tehsil toward those directions that improve obesity, for example? Can we show that change? We can talk about what it should be done. आप योग करिए, आप मेडिटेशन करिए, आप साल्ट कम करिए. That's individual. स्केल पे बदल के दिखाने में क्या कर सकते हैं हम? कुछ उसके एलिमेंट्स की बात हमने देखी है. इम्पैक्ट सोचो कि हम कैसे दिखा सकते हैं, because then it replicates. Otherwise, are we stopping at awareness and individual level change, which happens. At individual levels, we move to no sugar in the tea, and we move to some weight reductions, we give up smoking. It happens at individual level, because we're more familiar with that as doctors. So there are 4 points that I'd like to now make. Firstly, what can the doctors do? तो एक पार्ट तो हो गया कि आप इकट्ठे होकर प्रिवेंटिव स्ट्रैटेजीज, उसमें हमारी ट्रेडिशन, हमारी ट्रेडिशनल मेडिसिन, ट्रेडिशन ऑफ योग, ट्रेडिशन ऑफ एक्टिविटी, दिनचर्या, स्क्रीन टाइम, स्लीप, ये जो बातें हैं इनकी चर्चा बड़े स्केल पे नहीं होगी तो हमारा देश may have lifespan with secondary tertiary care, we may have prosperity, but we may be struggling with healthy lifespan. So let's be mindful, because as we move in the direction of 2047, one ambition is to be a $30 trillion economy, the other ambition is to have an average lifespan of more than 85 from the current 71, and because 2/3 of the mortality today is non-communicable disease, either we do primary prevention or secondary, and then all the treatment and all the costs, all the misery. This is a larger discussion I want, but we all are the most important stakeholder. I would say God assigned responsibility, and therefore we should talk about it. अब डॉक्टर क्या करें, उसके ऊपर कुछ बातें हो गई हैं. So I would like this workshop and the organizers and the thinkers in the room to think about clear directions to each one of us. 14 lakh doctors or 12 lakh doctors as we are. And of course extended to the Ayush doctors as colleagues, because they are also treating. What do we do? उसमें डॉक्टर गोयल ने जो एक बात कही वो बड़ा ज़रूरी है. ये 2 ग्राम सॉल्ट जो है वो पहले ही का डला हुआ है कि उसके ऊपर का है, जरा इसके बारे में क्लैरिटी होनी चाहिए. ऊपर से मत ऐड करिए. जो कुछ बातें हैं इसमें अभी क्लैरिटी नहीं है, हमें वो क्लैरिटी लानी चाहिए. ये हमारा ही काम है, हम ही नहीं करना. हम प्रोफेशन में हैं तो हम प्रिवेंटिव केयर वाले भी हैं, वो सोच वाले तो हैं ही. सो मैं चाहूँगा कि डॉक्टर जो 1-to-1 कॉन्वर्सेशन करता है टिपिकली, पहले उसकी बात करें. तो मेरे पास पेशेंट आया, बच्चा आया या बड़ा आया, जीरियाट्रिक पॉपुलेशन आई, and keeping in mind some of the nuances which you heard from Dr. Goyal, but there may be others, that keep in mind that the same advice may or may not be applicable to somebody, a Swiggy worker who is wearing a helmet and driving for 80 kilometers every day in the heat of the weather. Would you apply the same? तो कुछ सोच के इसको बनाना पड़ेगा, वो बात होनी चाहिए. इसको जेनेरिक मत छोड़िए, वो एक लेवल है, वो होना चाहिए. लेकिन अब जब आगे बढ़ेंगे तो हमें इंडिविजुअल पेशेंट को कहना है. अब एक तो हो गया कि सॉल्ट काउंट का ही है. अब जरा आगे इस बात को लेके जाते हैं. आज हमने सुना कि ब्रेड में भी प्रॉब्लम है. हमने ये भी आज बात जिसकी नहीं हुई है, द एलिफेंट इन द रूम आर द पिकल्स. हर घर में पिकल है, हर टेबल पे पिकल है, हर सवेर का पिकल है, शाम का पिकल. इसके बारे में कैसे कहा जाएगा, तो क्या मैसेजिंग होनी चाहिए, ये हम सबको मिलकर करना है. इफ यू ऑल स्टार्ट, वी ऑल स्टार्ट, इट इज गुड. इन एनी केस फ्रॉम द पब्लिक हेल्थ व्यू, the government and the others will eventually do in any case sooner than later. So first part is, what do I tell my patient? I deal with children. What is our collective advice? The pediatrician family should start talking about it. With disease, without disease. हमें कितना कहना है, इसके बारे में क्लैरिटी बहुत ज़रूरी है. जीरियाट्री पेशेंट में क्या कहना है, कौन से सीजन में क्या नहीं कहना है. वुमन ऑन ट्रीटमेंट मिल रही है तो कहाँ उसकी करेक्शन होनी चाहिए, ये हम जानते हैं. मेडिकल एजुकेशन में हमें सब बताया जाता है. बाकी चीज़ों में when we look at, we are told if this happens, don't do this, then you do this one, then algorithm and so on. So the first part is that in our practice, can we embrace this messaging, because this messaging is actually a universal messaging. 30% of people, individuals above 30 are hypertensive today. The new NFHS survey perhaps will show even further worsening. You know that. Obesity is rising. And I want to also emphasize here, when it comes to kidney disease, Dr. Kher is here, we would like to hear more about two chronic diseases from the context of primary and secondary prevention. One is chronic kidney disease, and the second is chronic liver disease. Let me say why. We all have been here for long. The importance of CVD, cardiovascular disease, people like Dr. Srinath Reddy and others started that way back in early 90s, if not late 80s. आगे बढ़ गया है. Salt की, hypertension की thinking clear. We are also hearing about diabetes mellitus. 254,000 deaths is roughly the estimate of diabetes deaths. I hear so little about chronic kidney disease as a policy enabler. I hear so little of chronic liver disease. Chronic liver disease is 2 lakh deaths, or 2,15,000 deaths in 2019 burden of disease. Chronic kidney disease 2,25,000. अगर इसको apportion जिसने भी किया है on the global burden of disease for framework, it's only less by 25,000. That's also perhaps whatever the estimate boundaries are. The point I'm making is why we don't talk enough about it. We have a mechanism today in operations. It should become perfect, it should become better, to test for blood pressure and test for diabetes in all these locations. And for non-communicable disease, 36 crore Indians have been screened just as a start. Over a period of time, much more should happen. Screening followed by treatment, followed by compliance, followed by control, ultimately, and so on. Why are we not screening for early onset of kidney, secondary prevention? प्राइमरी नहीं हो पाई तो जब डिस्टेबलाइज हुआ लिवर एंजाइम हम नहीं कर रहे, और उसकी वजह यह है कि हमने उस तरह का मॉडल ही क्रिएट नहीं किया. डायबिटीज़ वालों ने कहा कि शुगर करिए तो ये करो, लिवर वालों ने अभी नहीं कहा, किडनी वालों ने भी नहीं कहा. एंड यू हैव द प्लेटफॉर्म टुडे. इफ आई हैव अ पॉइंट ऑफ केयर टेस्ट, वी विल स्टार्ट इम्प्लीमेंटिंग इट soon. So I want us to think that there are other facets to non-communicable disease which must get attention. Liver failure, 220, I told you, 210,000 deaths. So ये भी एक चर्चा होनी चाहिए कि इसका मॉडल क्या हो, डिटेक्शन के बाद करना क्या है, उसको ठीक करके दिखाना है. किसी ने करके नहीं दिखाया. When I detect early on population, individuals know. On population, when I go, I do, next step will be this is how you will follow up, this is how you will improve the life of the people, the way you do individual level, but applied in a different way in a primary care setting. So that's also my concern, that these two disorders are languishing in a way. Not that we have the documents also on both of them, I can tell you that. लेकिन उसके बारे में चर्चा, उसके बारे में refining of the model, जन आंदोलन, engagement, and research to back how it is to be implemented should be undertaken. Of course, there is factors of even these two issues are, of course, diabetes in a big way, hypertension in a big way, obesity in a big way. So it's all interconnected. But surely, if one organ is now going to be knocked off, I want to remember that the people know it and we can take the best we can do, which you do for well-off patients that come to us. Facility में जब हम आते हैं तो होता है. So first part is, let's be clear, and as was stated, it should be visible in the medical education curriculum. क्या उसकी चर्चा करी हमने कि जरा देखें करिकुलम में ये बात हुई है तो क्या कहना चाहिए. सो पॉलिसी चेंज जो होती है या एक्शन जब इस लेवल पे जो हम मांग रहे हैं, तो ये इंग्रेडिएंट है. मैं कहूँगा कि इसके लिए भी बैठिए, करिकुलम को देखो, पीडियाट्रिक्स वाले को देखो, मेडिसिन में देखो, जीरियाट्रिक वाले में देखो, है किसी ने लिखा कि नहीं और क्या लिखा जाना चाहिए, उसके लिए आम राय बननी चाहिए. आप शुरू करोगे एक चीज़ है, कोई और करेगा, मैं करूँगा, किसी ने तो करना है. But I want to say these are some of the important things that we should do. So that's very briefly what the doctors would do. So what, as an IMA, what will we do? Educate the doctor कि आपने हर को मैसेज क्या करना है, कितना बोलना है, क्लैरिटी क्या है, वो 2 ग्राम क्या है, 5 ग्राम क्या है, exceptions क्या हैं. So that's my first part. Second is about regulation. Clearly, regulation is on the table of policy system very actively. These things are being discussed and pathways are being found. High fat, high sugar, high salt is not acceptable in formulations. In products in the market, the caps should be considered. We would like advice on this. Some of you may already be part of that whole area. Where now the issue is that we can talk about this for the industry produced products. What about our traditional हलवाई की दुकान? सोचो इसके बारे में कैसे नैरेटिव बने, उसको बैलेंस कैसे करा जाएगा. उसके अपने इम्पेरेटिव्स हैं. देयर इज अदर साइड, एक इंडस्ट्री है, एक आदत है, एक लाइवलीहुड है, एक ट्रेडिशन है. हाउ डू यू बैलेंस? आई लाइक टू हियर दिस इज हाउ थिंग विल चेंज. हाउ डू वी बैलेंस? इट्स नॉट वन एक्सट्रीम. वी हैव टू बैलेंस. We have to create a narrative that in the larger societal good. How do we, what is the message for that? Easy to say कि जो डब्बे में बन रहा है उसके ऊपर कम करो, ठीक है, वो हो गया. वो जब आप कहते हैं कि इसके बारे में क्या व्यू है आपका, कि जलेबी के अंदर जो हो रहा है उसके लिए क्या व्यू है, क्या स्टैंड है, डॉक्टर्स का क्या स्टैंड है, तो ये चलना पड़ेगा. एडवोकेसी पूरी करने के लिए दूसरी साइड भी का जवाब देने का हमारे पास होना चाहिए, ताकि हम उसको नेविगेट कर सकें. आप कर सको, मैं कर सकूं, ये हमें मदद मिलेगी. लेबल्स की बात होती है तो सेम थिंग अप्लाइज कि पैकेज वाला जो पड़ा हुआ है तो लेबल लग सकता है, लगना चाहिए, लोगों ने बनाए हैं, चर्चा चल रही है. लेकिन क्या दूसरे की चीज़ों के ऊपर भी लेबल होना चाहिए? क्या कुछ चीज़ें जो एक्सट्रीम वाली है बैन होनी चाहिए? उसके बारे में भी तो ये 2-3 टूल्स हैं रेगुलेटर के पास जिसको करा जा सकता है. उसकी आई कैन ओनली से दैट दिस इज ऑन वेरी एक्टिव कंसिडरेशन ऑफ द पॉलिसी सिस्टम ऑफ द कंट्री. Then there's the issue of taxation. Some people do mention that things that are bad, you tax them so that the consumption becomes less. This is a tool that's available. Some countries have used. Experience from other countries, if it comes to me in the form of, and to others, in the form of a good policy brief, we would welcome. We are aware that some countries, as was told, have been able to change this. Some have done gradually, some have done dramatically. If you think some states have done it, some schools have done it, some micro level. These best practices would be a very useful area for the regulation to be fine-tuned collectively. It's us, all of us. It's not government. It's all of us. There is no. It's not a square table. It's a round table. We are all part of this debate, and I'm glad that you are doing that debate. I'm so happy. I'm hearing at least. I still have to hear. Just a reminder. किडनी वालों ने क्या बताना मुझे, लिवर वालों ने क्या बताना है, तो वो उधर आ रहा हूँ. बहुत कुछ करने के लिए अपना. थर्ड पॉइंट इज अबाउट अवेयरनेस. वी सॉ वंडरफुल एग्जांपल्स अबाउट अवेयरनेस एफर्ट्स, फंडामेंटली इम्पोर्टेंट. देयर आर, you saw how this can be approached. We all should be part, larger society should be a part. Again, message refining, actually वही बातें फिर कि 5 ग्राम क्या होता है, इस 5 मिलीग्राम क्या होता है, उसको बारे में बताने का जो भी हमें किस तरह से होगा, उसका मतलब क्या है। तो ये हमें भी क्लैरिटी चाहिए कि मैसेजिंग उसके बारे में क्या हो। मैं कम सॉल्ट लेता हूँ का क्या मतलब है, मैं ऊपर से नहीं डालता हूँ लेकिन खाने में ही पहले डल गया तो उसका क्या होगा। थोड़ा सा इसको रिफाइन करने की प्रैक्टिकल सेंस में मैं कहूँगा कि ज़रूरत है, एंड दैट शुड बी थॉट अबाउट. The awareness elements, as you know, then flows into approaches, celebrities, noise. One very major target should be our children, school children. But school children are influenced by their parents and families and the practice in the family. And start making, and in the schools, and what happens around the schools. So that part also has to be taken, and keeping in mind that awareness is not targeted not only to the middle classes, which looks fancy, but also to others if it is an issue for them, which of course it is an issue for them. My fourth request is to create evidence. That's also our job. What works, what doesn't work. Which campaign led to a change in behavior? Nobody will tell you that. We conducted a campaign, yes. How many people changed? If we make a phone call to say कि हाँ मैंने कुछ 3 दिन के लिए तो अपना बदलाव लेके आए हैं. You have seen the biggest behavior change movement through Swachh Bharat. Demonstrate भी करिए. It's good thing to be happy कि हमने एक noise create किया, buzz create किया. पर buzz का action हुआ, intent तो वो थी, तो अगर नहीं हुआ तो कैसे refine कर सकते? What is it that changes behavior? And that also of something which we, which is part of our life every minute, every hour, or 3 times a day, 5 times a day. So that part, how does it come? Because we may think we are doing a lot. मैंने 1-to-1 भी कहा अपने पेशेंट को, कहा कि लेकिन वो तब तक नहीं बदला जब तक हमने इस तरह से नहीं कहा. एक्सक्लूसिव ब्रेस्ट फीडिंग, मेरे पीडियाट्रिशियन कलीग सारे 6 महीने तक करना, 6 महीने तक करना. कौन करता है? Exclusive breastfeeding 64%. In the 5th month drops to 45%. खाना खिलाना शुरू करना बेबी 6 से 8 महीने में, 6 महीने में शुरू करना, शुरू होता है 46%. And so on and so forth. So it doesn't mean the messages need to be backed up by perhaps other messages, other content, other convincing methods, using the science of behavior change. Only then will it happen. Awareness generation is the first thing, fundamental thing. It's a big lever. But then what changes behavior on scale? हमारे 2 काम, एक तो है कि अपने पेशेंट को क्या कहना है उसकी बात करें. मुझे क्या कहना है कि 2 ग्राम बच्चे 2 साल के नीचे नहीं लेना है. My grandson 4 years old has not been given milk with added sugar, for example. Just decided हो गया. अब थोड़ा सा वो शुगर की उसकी टेंडेंसी मुझे लगता कम है हम लोगों की बजाय. मेरे कहने का मतलब यह है कि पहले 1-to-1 किसने, सबने, हमने क्या कहना. धीरे धीरे फिर मूवमेंट बनेगी. DMA करेंगे, IMA करेंगे, पीडियाट्रिशियंस करेंगे, न्यूरोलॉजिस्ट करेंगे, गायनेकोलॉजिस्ट करेंगे. वो एक पार्ट है, लेकिन उसमें डेमोन्स्ट्रेट करिए कि चेंज हुई कि नहीं हुई. वहाँ रुकने से फायदा नहीं है. बिकॉज अ मैसेज डज नॉट मीन देयर विल बी ट्रांसलेशन. अवेयरनेस डजंट मीन दैट आई एम. किसको नहीं पता कि अल्कोहल खराब है, बाय द वे. किसको नहीं पता कि स्पीड थोड़ी कंट्रोल होनी चाहिए. So we must use the science of the day because these are so fundamental to our nation. If we are not healthy, the Honorable PM says, स्वस्थ भारत नहीं होगा तो विकसित भारत कैसे होगा. चेंज करके हम उल्टी तरफ चले हुए. सेकेंडरी प्रिवेंशन पे लास्ट पॉइंट मैं दोबारा रिपीट कर रहा हूँ, एफर्ट हो रहा है, होगा. हमारे पास दवाइयाँ हैं, हॉस्पिटल भी बन जाएंगे, प्राइमरी केयर के पाथवे भी बन जाएंगे, जान लगा रहे हैं. प्राइमरी प्रिवेंशन पे हम कहाँ जा रहे हैं, चाहे वो मेंटल हेल्थ की बात है, चाहे फिजिकल बोन हेल्थ की बात है, और समथिंग एज इम्पॉर्टेंट एज हाइपरटेंशन एंड ओबेसिटी की बात है. आई लाइक टू मेंशन हियर दैट a CNN survey shows that 10% of nationwide, 10% of our children between the age of 10 to 18 are pre-diabetic. मैं प्रिवेंट कैसे करूं, बताइए. बोलने से नहीं होगा. What is it that should be done? So I want to challenge you to take this thinking forward because we are the leaders. It is our job. But ये pathway बैठ के हो. deep dives in. Awareness meetings, great start. We value your time, your thinking, your triggers. Thank you very much. Jai Hind.
Thank you, sir, for the words of wisdom and providing a roadmap of strategies for the way forward to take this movement. And I'm sure with the policy guidelines and the regulatory aspects being covered in your speech shows promise for this very effort. I think the gathering of the medical professional is going to make a difference. As he said, we have to measure what we are doing in a manner in which we can assess what we can contribute as, low salt initiative. I think the change behavior will happen from this room and spread, far and wide. And I'm sure with all the strategic inputs that he has given, and of course, as an influential policy maker, we will see certainly fruits to our efforts of Sapiens Health Foundation and the Low Salter Group and the resolve to save lives. Once again, thank you so much for sparing your invaluable time and giving us a very exhaustive and comprehensive roadmap as strategy for the future. Thank you, sir, for your wonderful address. I request Dr. Lamba to do the honors to the guests.
Thank you, Dr. Sundar. So we are already late by the scheduled first lecture around 10:45. I will be finishing the felicitation in just 2 minutes. Now I request President Delhi Medical Association, Dr. Girish Tyagi sir, to felicitate guest of honor, Dr. Rajiv Sood. I request Senior Joint Secretary Dr. Abhishek to join for felicitation. Where is Dr. Abhishek? I request Assistant Secretary Dr. Kumar Gandhi to please join for felicitation. Dr. Rita Bakshi, Joint Secretary, please come on the dais for felicitation. Sir, आगे आइए. Now it's time for felicitation of our chief guest, Dr. V.K. Paul, our President, Delhi Medical Association, Dr. Girish sir, to felicitate guest of honor. Chief guest, Dr. V.K. Paul. Dr. Abhishek, I called your name, you will just please join. Dr. Ravi Chandran, founder of Sapiens Health Foundation. Sir, please come on the dais. Dr. Girish sir to felicitate Dr. Ravi Chandran, founder of Sapiens Health Foundation. The felicitation is over now. Now I request Dr. Umesh Khanna to please carry on the proceedings with from Mumbai Kidney Foundation.